This presentation is from Grafton Hills College by Lori Green, D.L. Brink, Gio Sosa, Artur Aslanian, and Diana Vites. We're going to take a look at the imposter syndrome among emergency medical technicians, and we're going to do this by looking at the big 5 personality traits. The imposter syndrome, as developed by Clance and Imes, is the great persistent worry that one is not professionally competent. One is afraid of being exposed as a fraud. The imposter syndrome is not recognized as a clinical syndrome in either the DSM or the ICD, but it is associated with heightened anxiety and depression. It is very common among first responders to medical emergencies. These individuals can work in a variety of career fields, such as ambulances, hospital, fire departments, search and rescue. They provide basic life support, cardiopulmonary resuscitation, and are present at multiple casualty incidents. At Grafton Hills College, our Emergency Medical Services program involves 4 EMT courses. These involve an 8-hour course 1 time a week for 16 weeks. It's a 1-semester program leading to national certification and involves field exposure to basic life support. Our presentation today is mostly in the field of industrial organizational psychology because it involves a prediction of who will be successful in this future career role. We want to predict who might need extra help in order to overcome obstacles to success in this career. And so we turn to a theory of personality, Costa and McRae's Neo 5. We looked at various components such as introversion, extroversion, agreeableness, openness to experience, neuroticism versus emotional stability, but we thought perhaps the most important factor to consider was that of conscientiousness, the idea of planning one's life, doing what is right rather than what is easy. The hypotheses that we came up with is we thought that EMT students would manifest the imposter syndrome if they were lower on the variable of conscientiousness. We also thought that the EMT students manifesting the imposter syndrome would score lower on emotional stability and lower on extroversion. Our method was to look at a sample of 152 students, a cohort attending the fall of 2019. About 3/4 male, median age category was in the 20s. Most had a future career goal of being a firefighter. Our apparatus was using a questionnaire measuring several variables. The one that we really wanted to focus on for the operational definition of the imposter syndrome was the idea of feeling unprepared for this career. We looked at the Neo 5 personality traits, specifically using Gosling's 10-item personality inventory, which involves Likert scaling. And we looked at some of the other variables, such as prediction of passing the course, using a 4-level frequency likelihood scale, very likely, somewhat unlikely, or very unlikely. We also used confidence in passing this class, a 5-level intensity scale. We also looked at self-esteem using a 7-level FACES scale. We also looked at the APA Cantrell scale of measuring stress on a 10-step ladder. In terms of looking at the feeling of unprepared, our operational definition of the imposter syndrome, We looked at a frequency scale, 5 levels, always, most of the time, about half the time, seldom, or never. Now, our procedure was to look at 4 different EMT introductory classes, starting in the October of 2019. Data analysis used JASP specifically. We looked at Spearman rank order correlation coefficients. And we looked at stress levels, found they were pretty close to the national norm. We looked at self-esteem, found those were also pretty consistent with some other norms that we've seen before. Regarding the question of the imposter syndrome, feeling unprepared for the career, we found that the median N mode was only seldom 2 in our range of 1 to 5. In terms of the individual personality traits, we found that most of them were fairly high on the 2 to 14 theoretically possible scale: agreeableness, openness, emotional stability, extroversion, and conscientiousness. Now, who feels unprepared for this career? It was the people with the low conscientiousness. We found a negative correlation there. And the low self-esteem, the low extroversion, the low emotional stability, and the low openness. Now, we have essentially confirmed all 3 of our hypotheses, and we hope that the next cycle of research will use qualitative methods to explore some of the relationships between these variables and the context in which they are expressed. Our goal is to nurture resilience and reduce the attrition and burnout in the program. We'd be happy to answer some questions, and if we can't answer them here, contact us at Crafton Hills College, and we'll be happy to answer them there.